So a joint news conference that we're having this afternoon to share information regarding our regional stay-at-home order. Today is Saturday, December 5th, and we have today Dr. Stephen Monday, our County Health Officer, Jeanette Angulo, Director for the Imperial County Public Health Department, and Luis A. Plancarte, Chairman for the Imperial County Board of Supervisors. Tenemos esta conferencia de prensa esta tarde para compartir información sobre el orden regional de quedarse en casa. Tenemos al Dr. Stephen Monday, que es el médico oficial del Condado Imperial, Jeanette Angulo, quien es la directora del Departamento de Salud Pública del Condado Imperial, y el señor Luis A. Plancarte, el presidente de la Mesa de Supervisores del Condado Imperial. So the way we're going to do this is we're going to have Dr. Monday offer his comments and updates, then followed by Jeanette Angulo, the director, and followed by Chairman Luis Plancarte, and then we'll open it up to questions from the media. Dr. Monday?
Okay, hello everybody. Sorry that we're having to do this on a Saturday, but as was noted on the conference that we did on Thursday, and as was announced by the governor, the state health officer has put out a new order described as a regional stay-at-home order that's dated December the 3rd, 2020. And the reason for this is because that we have continued to see a surge in cases. Again, it's not unique to Imperial County or even to the state of California. It's going on across the nation. But we continue to see new cases, we continue to see increasing hospitalizations, and we're continuing to see increased use of our ICU capacity. And it's really that last measurement that has really gotten everyone concerned, because we understand that if we don't intervene and try to slow down the rate of increase, that we're going to exceed hospital capacity. As an example, it was noted in the regional stay-at-home order dated 12/3 that the number of new hospital admissions had increased in the state of California from 777 on November the 15th to 1,651 on December the 2nd. And the problem that we know, as they note in this order, is that there's always a lag between case identification and hospitalization, so we know this is going to continue to increase. And so based on projections, they're worried that by the middle of December that we're going to exceed our capacity. So it was noted in the order, this is a regional stay-at-home order, and what they determined was that the state would be divided into regions. We are in the Southern California region, and that the regions would be looked at together in terms of ICU capacity, and that once the capacity drops to less than 15%, that this order would kick in with additional restrictions on business and personal activities in order to limit the mixing of people and therefore the spread of COVID-19. I was notified late last night that the Southern California region, of which Imperial County is a member, has indeed exceeded that 15%, and therefore the the regional stay-at-home order now kicks in. And so the way that it works is the notification takes place today. And so then we have until the end of the day tomorrow, Sunday, for the implementation to take place so that everybody has time to get ready. So what that means is that at 23:59 or 11:59 p.m., for those of you who weren't in the military, the order will take place, and all of the restrictions that are noted will be mandated and must be followed. And you can get details about this from the state website. Just so you know, there is conversation going on between the state health officer and the local health officers to get clarifications to make sure that we understand some of the specifics. And as we get additional information, we will share that with everyone. But if you do look at the state site, they note that as of December 4th, For the Southern California region, our ICU bed capacity is at 13.1%. And again, that means that we're below the 15, and that the regional stay-at-home order kicks in as of December the 5th, which again is tomorrow or Sunday. So rather than spending the time just reading off everything that the stay-at-home order does, I'll just review a few things so that people are aware, and you can of course look up the details. And that is that the following sectors need to close, and that's indoor and outdoor playgrounds, indoor recreational facilities, hair salons and barbershops, personal care services, museums, zoos, and aquariums, movie theaters, wineries, bars, breweries, and distilleries, family entertainment centers, card rooms and satellite wagering, limited services, live audience sports, and amusement parks. The other sectors that they list on the website, they describe have modifications, as well as the mandate for 100% masking and physical distancing, and that includes outdoor recreational facilities, retail, and I would note specifically that retail is only limited to 20% of capacity, and they must actually meter the capacity, and they do not allow eating or drinking. Same thing for shopping centers. Hotels and lodging are only open for critical infrastructure support. Restaurants are only allowed to do takeout, pickup, and delivery. Offices are meant to do only remote work, except for critical infrastructure sectors where it is not possible to do remote work. Places of worship and political expression are now limited to outdoor services only. And then entertainment, production, including professional sports, only allow outdoor operation without live audiences, and that it's recommended they do a testing protocol, and they have bubbles. And then they finally note that the following sectors are allowed to remain open when a remote option is not possible with appropriate infectious disease prevention measures, including the 100% masking and distancing. And that is critical infrastructure, schools, non-urgent medical and dental care, and child care and pre-K. I would comment specifically with regard to the non-urgent medical and dental care. The reason that they listed that specifically is, if you remember, when we had our initial closure that it took place back during the first surge, they did actually restrict what they called non-urgent I'm sorry, I'm blanking on the word I want to use, but non-urgent medical care. Elective, sorry, couldn't think of the word. Elective procedures. What we noted is that elective is really not really the appropriate word to use. What it really has to do with time-sensitive procedures. And we do know that because some of these things were delayed, that it did lead to some adverse outcomes. And so that's why the state has made the decision that they will allow the regions to make those decisions individually to make sure that as much healthcare as is necessary and available can be provided. So just wanted to make a little comment in that regard. So as I said, this literally just came out. We are the first region to go into this new restricted level. They are, of course, monitoring everyone else as well. There are still questions to be answered, and as we get additional information, and as additional information is added to the state website, then we will be happy to share that. We are in the middle of revising my most recent health officer order to reflect these changes from the state, and anticipate that shortly after this press conference that the new local health officer will be out, and again it will just reflect that the changes in the state order are of course being implemented in Imperial County as well. I just want to emphasize again, the reason that this is necessary is because the surge has been ongoing, and we have taken measures at the federal, state, and local level, and they have become increasingly more restrictive. And despite that, unfortunately, we're continuing to see increases in cases, increases in hospitalizations, and increases in ICU use. And really, we are at the point now where if we don't manage to contain this, that we're not going to have the hospital capacity that we need to take care of everyone. And so it's really important that everyone understand that everything that you're doing is so vitally important, because it's not just about keeping yourself healthy and safe. It's about you not making someone else infectious, who can then potentially infect someone else, because some of these people are going to be high risk. Some of them are going to get sick. Some of them are going to go in the hospital and therefore need to go into the ICU. And so if we can get everyone to follow the safety measures, if people will distance and if they'll mask, if they will follow the guidance with regard to not gathering with other people outside their household, we really can restrict the spread of this disease and therefore keep people from getting sick and protect our hospital capacity. Keep in mind, it's not just about COVID. The hospitals have to manage all of the other medical problems that are going to be going on regardless of whether COVID is here or not. So it's just really about what we can all do as individuals to keep ourselves and those around us safe and make sure that we have the healthcare capacity, including the hospital and ICU capacity, that we need to take care of our population. So I'm going to stop there and see if either Jeanette or Chairman Plancarte has anything they would like to add, and then we will proceed from there.
Yes, thank you, Dr. Monday. My statement is actually going to be in Spanish. We wanted to reach Spanish media press and our Spanish-speaking community. Muy buenas tardes, mi nombre es Janet Angulo, soy la directora del Departamento de Salud Pública y hoy estaré dando algunos informes muy importantes para nuestra comunidad. Como ya saben, la tasa de casos de COVID-19 y las hospitalizaciones continúan aumentando a un ritmo alarmante y amenazan con abrumar el sistema de prestación de atención médica, y por ese motivo se están implementando intervenciones adicionales para tratar de mitigar la situación en California. Ahora, el Departamento de Salud Pública del Estado de California oficialmente nos notificó que la orden regional de quedarse en casa se activaría para la región sur de California, la cual incluye al condado de Imperial y a otros 10 condados, y esta orden entra en vigor el día domingo 6 de diciembre a las 11:59 p.m. Ahora, esta orden se activó ya que la capacidad de la unidad de cuidados intensivos de la región del sur de California cayó por debajo del 15%. El condado de Imperial, junto con el resto del sur de California permanecerá durante al menos 3 semanas bajo esta orden regional. Ahora, ¿qué significa la orden regional de quedarse en casa? Como ya mencioné, a partir de las 11:59 el domingo 6 de diciembre, los residentes deben de quedarse en casa tanto como sea posible, obviamente sin dejar de hacer cosas importantes como ir al médico o comprar alimentos, entre otras cosas. Los sectores, en cuanto a los sectores, todas las operaciones en los siguientes sectores deben cerrar. Lo que son áreas de juego en interiores y exteriores, instalaciones recreativas en interiores, peluquerías y barberías, servicios de cuidado personal, por ejemplo, salón de uñas, lugares donde hacen tatuajes o perforaciones, lugares de masaje, entre otros. También los museos, zoológicos y acuarios deben cerrar, tanto las salas de cine, bodegas de vino, bares, cervecerías y destilerías, centros de entretenimiento familiar, deportes con audiencia en vivo y parques de atracciones. Los siguientes sectores tendrán modificaciones adicionales, además de que se requiere al 100% el uso de cubrebocas y el distanciamiento físico. Las instalaciones recreativas en exteriores. Se permite la operación de áreas recreativas al aire libre, pero sin ventas de alimentos, bebidas o alcohol. Además, no se permitirá el acampar por las noches. Con respecto a tiendas minoristas y centros comerciales, se permite el funcionamiento en interiores al 20% de su capacidad con medición de personas en la entrada. No se permite el consumo de alimentos o bebidas en las tiendas o en los centros comerciales. Además, se deben establecer horarios especiales para personas mayores y otras personas con afecciones crónicas o sistemas inmunitarios comprometidos. En cuanto a los hoteles y lugares de alojamiento, se permite solo las operaciones para el apoyo de los sectores de infraestructura crítica. En cuanto a los restaurantes, solo se permiten los servicios para llevar, recoger o distribuir comida. Las oficinas se permite la operación remota, excepto para los sectores de infraestructura crítica donde el trabajo desde casa o de un lugar remoto no es posible. Para los lugares de servicios religiosos o de culto y expresión política, se permiten solo los servicios al aire libre o las actividades al aire libre. En el área de producción de entretenimiento, y esto incluye los deportes profesionales, solo se permite la operación sin audiencias en vivo. Algo importante para las escuelas elementales y secundaria. Se pueden seguir operando los grupos pequeños o cohortes siempre y cuando se sigan las pautas establecidas por el Estado. También pueden operar las escuelas que anteriormente recibieron una exención. En el Condado Imperial, una sola escuela recibió dicha exención este pasado octubre. Ahora, los siguientes sectores pueden permanecer abiertos cuando una opción para operar remota no es posible. Esto incluye el sector de la infraestructura crítica, atención médica y dental no urgente, el cuidado infantil y preescolar. Ahora, ¿cuándo finaliza esta orden regional? Los condados pueden salir de la orden regional de quedarse en casa después de 3 semanas si la capacidad de las unidades de cuidados intensivos de los hospitales de la región alcanza el 15% o más, y esto será basado en una proyección de 4 semanas. Ya que se llegue a ese punto, y a cada condado de la región se le asignará un nivel según el plan de California, y ese nivel dependerá de las métricas del condado. Estas métricas serán la tasa de casos y la positividad en pruebas. Esos niveles son el nivel morado, rojo, naranja y amarillo que ya conocemos. Estas intervenciones se están implementando, como ya dijimos, por tanta actividad de COVID que estamos viendo en la comunidad, y no solo eso, la capacidad de los hospitales para recibir a los pacientes ahorita es un momento alarmante porque no hay capacidad y eso sucedió aquí en el sur de California. Así es de que estas medidas se están tomando como medidas de prevención y para poder proteger y servir a la comunidad de una mejor manera. Y en este momento se estarán preguntando, pues, ¿qué podemos hacer? ¿Qué se recomienda? Aunque estemos en casa, se le recomienda a las personas que son del mismo hogar, a los miembros del mismo hogar, a mantener la salud física y mental, y esto se puede hacer yendo de manera segura a un parque, caminando, haciendo ejercicio en una bicicleta, de nuevo de una manera segura y siempre manteniendo el distanciamiento social. También hay maneras de mantenerse conectados con sus seres queridos, sus amigos, de manera virtual. Así es de que hay mucha más información que estaremos compartiendo con ustedes como pasen los días. Por lo tanto, si buscan información adicional, pueden visitar el sitio web del estado, que es covid19.gov. Y nosotros, el Departamento de Salud Pública del Condado Imperial, también estaremos compartiendo más información en nuestro sitio web y en nuestras plataformas de medios sociales. Gracias.
Gracias, Jeanette. Señor Luis Plancarte.
Gracias, María. Thank you, Maria. Good afternoon, residents of Imperial County, Mexicali, and the greater region. I will repeat this in Spanish at the end. Buenas tardes, residentes del Condado Imperial, Mexicali, nuestra región. Repetiré estos comentarios en español en unos minutos. Today, we find ourselves in a very familiar place, once again asking the public to help make sacrifices for their greater good. We have all, including myself, been greatly affected by COVID-19. Unfortunately, we have lost loved ones, many members of our communities to this epidemic. Many have suffered and are continuing to battle this illness. My prayers, my family prayers, and all us public servants' prayers go to those families who are battling or have battled this pandemic. As part of a larger binational region, which includes Imperial Valley, Mexicali and its valley, and the Southern California region, we must ask all to work together to help our communities remain safe and healthy. The new guidelines that Dr. Monday and Director Angulo explained today are necessary for us to ensure that Imperial County, as well as our entire region, remains healthy and strong. I have no doubt in my mind that if we do this together, united, we will conquer COVID-19. And in advance, I thank you for the cooperation. Residentes del Condado Imperial, mi nombre es Luis Plancarte, soy el presidente de la mesa directiva del Condado Imperial. Quiero darles las buenas tardes a todos los residentes del Condado Imperial, Valle de Mexicali, Mexicali y su valle, y miembros de nuestra comunidad regional en general. Hoy nos encontramos en un lugar que para nosotros ya es familiar, una vez más pidiéndole ayuda al público para hacer sacrificios por el bien mayor de nuestra comunidad. Todos, incluyendo yo, mi familia, de una forma o de otra, hemos sido afectados por COVID-19. Desafortunadamente hemos perdido seres queridos y miembros de nuestra comunidad a causa de esta pandemia. Muchos han sufrido y continuarán sufriendo, luchando contra esta enfermedad. Mis oraciones, las oraciones de mi familia y todos los sirvientes públicos estamos ofrecidas a todas esas familias que siguen luchando. Como parte de una región más grande binacional que incluye el sur de California, claro, Mexicali y su valle, todos debemos de trabajar juntos para ayudar a nuestras comunidades a permanecer seguras y saludables. Las nuevas pautas que el doctor Monday y la directora Angulo explicaron son necesarias para que todos garanticemos que el Condado Imperial, así como nuestra región, se mantenga saludable y fuerte. Yo estoy seguro que trabajando juntos y unidos derrotaremos al COVID-19. Por antemano les agradezco su cooperación y vamos a ayudarnos unos a los otros manteniéndonos sanos. Gracias.
Thank you, Chairman Plancarte. So now we're going to open it up to any questions from media regarding the regional stay-at-home order. Are there any questions?
I guess they're all going to come from me. So I guess my first question would be, now that the stay-at-home order is banning all public gatherings of any size, or all gatherings of people outside the home of any size, what is going to be is the enforcement piece going to be increased at all, or how is that going to work out?
So Richard, I'm going to say the same thing that I say every time that we get asked this question. The health department is about keeping people safe and healthy and sharing information and making sure that they have what they need. The enforcement piece does not come from the health department. And so I would suggest that you reach out to the appropriate agencies with regard to that. I mean, that's not what today's press conference is about.
I understand that. I still have to ask. Thank you. Let me ask on specifics. Does this affect gyms?
So we're not going to answer any additional questions with regard to particular sectors because that was the nature of the call that we had today with the state, and they are putting together additional guidance, which they are going to share with us because they have to push it up through their chain of command. So we're only going, anything that you would like to see that's actually on the website, obviously it's already there, but we're not going to have any additional discussion because we're waiting for some clarification from the state.
Okay, Jim's is not on the, that's not on the website at all. Okay, thank you. As far as the 4-week projections, is there anything you can add on that? I know that it said is it at the end of the 3 weeks that it then is a 4-week projection, and what is going to go into that 4-week projection on figuring out if it stays closed or if it can reopen?
Yeah,
in the region?
the 4-week projection and the 3-week closure are two separate things. When they talk about the 4-week projection, they're just talking about what the number of ICU bed capacity would be in 4 weeks. That's kind of what it is. So in other words, they're looking about what's going to happen in the future. So for example, the way this works is that because we have now hit that threshold of 15%, then we are moved into this situation for the next 3 weeks. And then they'll assess in 3 weeks to see where we are. And the way they will make that determination is using the projections over a 4-week period. Once they do determine that we have met the parameters to come out of this new order, meaning that we do have a capacity of greater than 15%, then each of the counties will be able to move out of the new restrictions, and they will move into whichever tier they would be based on the normal measurements that are used in the blueprint that was already in place before this order came to be.
And again, I know this was not the intent of the press conference today, but since we are here, is there any updated data for today that you can reveal that isn't part of the dashboard as far as transfers, ACS numbers, anything like that?
No, there's nothing new to share with regard to that today. All right, so, and Richard, just so you're aware, the plan as of now will be that we will have our normal Thursday press conference that we typically do. And assuming that we have updates with regard to the questions that we pushed up to the state this morning along the lines of like what you were asking, then our plan will be to share that information. Obviously, if we get it sooner and we can get it into a format that we can share it, we will share it before that. But we had many of the same questions that you alluded to, and we did ask for clarification, which we will share as soon as we get it.
In terms of the ICU information that's going to be on the dashboard, is that going to be updated any more regularly than it is now? Because I noticed there's a 2-day lag on the ICU and hospitalization information versus the testing or positivity rate information.
Right, but like we've discussed in many, many occasions, there's always going to be a lag in the data, and that has to do with the fact that they have to collect the data, it has to be standardized, it has to be confirmed that it's correct, and then it has to be verified and pushed out, so there's always a bit of a lag. So the state, one of the things they discussed this morning as well is how often they're going to be kind of using this data to make a determination. And that's another question that they are reviewing and that they're going to get back to us. But yeah, with regard to any data that we have on our website or any data that goes on the state website, there's always a bit of a lag just because it takes a while to collect the information.
I was specifically asking about Imperial County hospitals and the data on our dashboard. That seems like that would be a simple matter of reporting from El Centro and Pioneers, not going all the way up to state and bouncing back.
There's a reporting mechanism that the hospitals go through to the state. And that is what every hospital in the state does. They send that information and that gets validated, collated, whatever, and gets updated. And so that's the reason it takes a little bit of time. And keep in mind that the hospital data actually changes multiple times per day because they discharge people, new people get admitted, et cetera, et cetera. So it's always just a snapshot. And honestly, by the time it gets loaded onto the website, it's probably already changed because things have been happening. So we do load the data as soon as we are able to verify that we have accurate data. And frankly, a 2-day lag is pretty good when you think about all the different things that have to come into collecting that data. I think Jeanette wanted to comment on that as well.
That's what I was going to say. That data is from the state, from that survey that is collected throughout California. And then we take that data and in turn push it out into our dashboard. That's it.
Okay, thank you very much, then. I appreciate that.
Maria, before we close, could you repeat both maybe in Spanish and English in the event that local information becomes available and updated? Is there a local preference, either a website, whether it's Imperial County Public Health or the county or social media outlets? How are we going to be sharing local updates that we may have?
So yes, Chairman Plancarte, so the way we're updating information, like immediate information is being posted on our social media platforms, on the Public Health Department's Facebook page primarily, and then we're also updating on our website. So I think that for real-time information, I encourage everyone to follow us on social media and our Public Health Department Facebook page. Para la información actualizada, lo que estamos haciendo en el Departamento de Salud Pública, estamos compartiendo toda la información en las redes sociales, en la página de Facebook del Departamento de Salud, así como en la página de Internet del Departamento. Y la información más actualizada y más reciente, invito a todos que nos sigan en las redes sociales para que la reciban tal cual está saliendo la información.
Gracias, María.
Thank you. So again, this is a reminder that we're going to continue with our regular news conferences every Thursday afternoon at 3. But if we have breaking news or information that we need to share immediately, we'll do something else like this and have another news conference in between or before then. So thank you everyone for joining us, and we'll see you next week. Thank you.
Thanks everyone. Thanks, Richard.
Thank you.